So you probably wouldn't think these two have very much in common. But according to David Oliver, borderline personality disorder expert and researcher, both of these individuals most likely suffered from borderline personality disorder. Borderline personality disorder, a mental illness now known to have biological causes, is a serious condition that destroys lives and relationships. Today I'm going to discuss first what borderline is and what causes it. Then I'll tell you some statistics about the people who have it, and then I'll discuss treatment options for those diagnosed with the disorder. In its simplest terms, borderline is a disorder of mood regulation. And until recently, this has been considered an untreatable disorder. Now, to be considered borderline, you need to meet 5 of 9 criteria that are outlined in the Diagnostics and Statistical Manual of Mental Disorders, 4th edition. And they use some pretty heavy language in there, so I'm going to use the language Dr. Roxanne Dryden-Edwards uses on medicinenet.com to describe these criteria. First, there's unstable self-image, unstable relationships, unstable emotions that are stress-related, desperate efforts to avoid being abandoned, significant impulsivity, things like reckless sexual behavior, reckless driving, self-injury, substance abuse, recurring suicidal behaviors, threats, or attempts, chronic feelings of emptiness, inappropriate, intense anger or difficulty managing anger when it occurs, and transient stress-related paranoia or severe dissociation. And that's all pretty complicated, though, and I think Kiera Van Gelder put it best in her memoir, The Buddha and the Borderline, when she said, first, we're highly sensitive to emotional stimuli, meaning we experience social dynamics, the environment, and our own inner states with an acuteness similar to having exposed nerve endings. Second, we respond much more intensely and more quickly than other people. And third, we don't come down from our emotions for a long time. Once the nerves have been touched, the sensations keep peaking. Shockwaves of emotion that might pass through others in minutes might keep cresting in us for hours or sometimes days. Now, many experts believe that borderline is caused by a combination of nature and nurture, your environment and biology. Now, your environment in early childhood plays a big part in shaping your personality. If you're raised in a home where there's abuse, neglect, or chronic invalidation, you're more likely to develop borderline personality disorder. But being raised in an abusive home by itself is not enough to cause borderline. There needs to be some underlying biology in place as well. Now, Dr. Wayne Fenton, who's a former assistant director of the National Institute on Mental Health, talks in the 2009 documentary Back from the Edge that new science has revealed that there are physical differences in borderline brains that make it impossible for us to regulate our emotions effectively. People with borderline have an overactive fight-or-flight response. These are normal people or non-borderline brain scans being shown a neutral or non-threatening stimulus, and there's really no reaction in their fight-or-flight response. But when you show these same neutral images to borderline patients, there's quite a bit of activity in their fight-or-flight response. They perceive these things to be threatening. Now, not only do we have an overactive fight-or-flight response, but we also have an underactive prefrontal cortex. That's the part of your brain that controls your higher order of thinking, your logic, your ability to control or self-soothe from your emotions. Now, in a healthy control person under stress, the prefrontal cortex is activated and is working hard. In the borderline patient under stress, there's very little activity in the prefrontal cortex. So not only do we go from 0 to 60 just like that, but we also don't have any breaks. We don't have the ability to slow ourselves down from these intense emotions once we've achieved them. According to borderlinepersonalitydisorder.com, borderline affects approximately 14 million Americans. Now, to put that into perspective, the city of New York has a population of just over 8 million people. One of the most frightening aspects of borderline, especially for those around someone with borderline, is the rate of suicide and self-injury. 10% of people with borderline personality ultimately die of suicide. 55 to 85% self-injure with things like cutting, burning, hitting themselves. And 33% of the youth suicides in this country have features of borderline personality disorder. So you might be wondering now, what can someone with borderline do to get help? Well, there's really no anti-borderline drug on the market, but some borderlines have found relief from some of their symptoms of anxiety and depression with drugs designed to treat those disorders. Psychotherapy is essential, but only if you have a trained therapist, someone who understands borderline, because traditional treatments can actually make someone with borderline worse. The only proven treatment that's been found is something called dialectical behavior therapy, or DBT. DBT was designed by Dr. Marshall Linehan at the University of Washington, and it teaches us coping skills, distress tolerance, and communication skills, among other things. Now, while borderline is a serious, destructive, and sometimes fatal disorder, there's hope for us borderlines in the form of dynamic therapies like DBT. Mary Zanarini at McLean Hospital in Massachusetts studied 290 patients who had been hospitalized with borderline over 10 years and found at the end of the study that at least half of these patients had recovered. That means that now borderline is no longer an untreatable disorder. It's considered the good prognosis disorder because so many people can recover from it with work. So now that you know the symptoms of borderline, if you think you or someone you know might meet the criteria for BPD, please seek help immediately from mental health professionals. Do not diagnose yourself. Now, in the links below, I have some more resources and that list of criteria again for anyone who's interested. Thank you.